Contraindications for stretching and joint distractions. We want to consider, but are not limited to, acute injuries, muscle strains and ligament sprains, bone breaks, anything that's not normal there. Conditions such as osteoporosis or arthritis. When we add in that traction, we want to include another element of contraindications. So we don't want to be doing joint distractions on anybody with hypermobility, the joints that already have a lot of range of motion, because our whole goal of the joint distraction is to increase range of motion. So just knowing what your patient needs there is vital. Additionally, anything with an inflammatory disease at the joint, like osteoporosis or arthritis, and even bursitis, if we're going to stretch that joint with an inflamed bursa, it might make it a little bit worse because we're rubbing those tendons and ligaments over top of the bursa as we bring it into full range of motion. So something to be considerate there. But keeping in mind that everybody is different and needs different things. So starting with some treatment modifications, which are similar to the ones of cupping. You're going to start with no joint distraction. Just bring it into the range of motion and see how they're feeling. Then you're going to start to go into a little bit of a deeper stretch. Maybe add a small joint distraction to end range, keeping the pain anywhere from like a 1 to a 4 instead of the average 6, as mentioned earlier. These changes will span over days to weeks to months and building during each session and keep going the next session.